MemorialCare is an integrated healthcare delivery system located in Southern California, and we're comprised of 5 acute care hospitals, one of them being a full-service children's hospital. In fact, it's one of the largest children's hospitals in the nation. We also have a physician division of both employed physicians and independent practice physicians, and then an entire network of ambulatory centers spread throughout the region. So we have roughly 200 sites of care. Our evolution to being an integrated delivery system really started some 20-some years ago, when we were then what I like to call a system of hospitals. Basically, hospitals all in the same parent company, but not working together to optimize being part of a system. We then evolved to being a hospital system where we centralized all that we could to drive down the cost at the provider sites. And then as the years passed, we added the physician division, the ambulatory division, the health plan, and all of that runs off the same backbone. Our goal is basically ultimate systemization, so we can drive down the cost at all the local provider sites. Being part of an integrated health system allows us to offer the patients really an integrated experience. That is to say, if they go to their primary care doctor and do all their registration and all that's required, and then need, say, imaging service, or they need to go to the ambulatory surgery center, they don't need to re-enter all that. We know them when they show up. We like to say, we know you regardless of where you access our health system. And so for them, it's more seamless, and they can access data from any one of our locations. We have one EMR that spans all of our provider sites, and it can talk to itself. So that gives the patient more seamless access to all their healthcare providers and locations. MemorialCare adopted the tagline, revolutionizing value in healthcare, some years ago, because we really did believe that what we're working on, even though it wasn't necessarily immediately accretive to our health system, in fact, our net income shows that what we're doing is not benefiting our health system. It's benefiting other people along this kind of siloed health system that we have currently in the United States. But we decided that we want to be an example to push others throughout the United States and health systems more toward value and as quickly as possible. In fact, one of the ways we've tried to do that, given the number of ACOs we have in California, we were one of the first to begin to realize that when you're in multiple ACOs, each from a different health plan or a different employer, they all define the outcomes you want to achieve differently. And early on, we had 3 different definitions on how we should assess depression and how frequently it should be done. And of course, that drives your frontline clinicians absolutely crazy. And so we tapped on the Integrated Healthcare Association, a California-based multi-sector organization, and said, can you address this issue? For us, it was solving a problem, but we knew it'd solve a problem for others, and it would also remove one barrier to people moving toward value-based care. And by golly, they did. They got all health plans to agree to a set group of criteria that how ACOs would be measured. Then the employers began to agree. Boeing agreed, Intel agreed, Disney agreed, and now the state of California has agreed. Well, that solved the California problem. That allowed me then to take that work set and provide it to the Healthcare Leadership Council, a national group in Washington, D.C., to say, can we get this expanded nationally? So we can really push toward value throughout the country, because we are truly passionate that that's the way the system needs to move.